India is breaking COVID infection records for the 12th day in a row. Today, the country reported more than 300,000 new cases of the deadly virus. Almost 219,000 people have died from the disease in India, but the actual death toll could be much higher. Elizabeth Palmer brings us an update on the pandemic in India and in countries around the world.
India's COVID surge is getting worse. Everywhere there is a shortage of oxygen, in the hospitals and on the street, where family members line up for hours to refill tanks for patients at home. A Sikh temple in East Delhi even set up curbside oxygen for the very sickest, like Abu Sadat, whose brother is doing what he can until he can find hospital care. He's been looking for more than a week. As funeral pyres burn day and night, Indians are both devastated and furious. The country managed to beat its first COVID wave a year ago, and authorities opened up even to mass religious and political gatherings. Now, Indian families, especially the poor, are paying the price. The other COVID hotspot is Brazil, with a per capita death rate even higher than India's right now. A vaccination program that's reached into Brazil's vast interior has distributed more than 40 million doses. But in the cities with no lockdown, it's no surprise the virus has continued to spread. And in Turkey, where the COVID rate started to climb steeply last month, authorities, anxious not to lose control, imposed the country's first ever national lockdown. And from Europe, at last, some good news. Both deaths and infections are falling as vaccination rates rise, and some countries are even starting to talk about opening their borders again to foreign travelers. Elizabeth Palmer, CBS News, London.
So UNICEF representative to India, Dr. Yasmin Haque, is with us now to talk more about that country's fight against COVID-19. Thank you so much for joining us, Doctor. We've been covering this a lot over the past few weeks, and it's really, just one heartbreaking story after another one, including, the story that we just ran where, we saw a brother literally driving his sibling around for a week looking for a hospital that will take him. What can you tell us about the situation in India's hospitals right now?
So the situation, as you can see, it is one of desperation, where people are really looking to see where they can find the type of care that is needed, and it's not easily available. And this is really the time for us to see what else we can be doing. So to alleviate the sufferings that people are seeing, we need more oxygen equipment, we need more testing facilities, and that's where a lot of our focus is, to keep that emergency supply pipeline going. At the same time, it's how can we keep more people from being infected and affected. So the crucial behavior of masking, of hand washing, of not going out into crowds, and to really, at the first sign of not feeling well, to start taking measures to keep your, people have started with supporting people in breathing exercises. People I've spoken to, at times, the moment you panic, your breathing, you're losing oxygen. So how to keep the calm, how to help people really, and the instance you showed of how communities are coming together to support people at this time, this is absolutely crucial.
Well, when I saw the young man in that story with his brother and the mask on, and he's sort of pumping at his chest, I thought to myself, oh my gosh, we have sort of a whole country of citizens who have had to learn all this medical stuff, because it seems like in many cases people are kind of fending for themselves. They're finding ways to purchase their own oxygen, finding the equipment, bringing their loved ones to the hospitals. You mentioned that UNICEF is sending oxygen, testing machines, other supplies that they need in India. I don't know if it seems like India needs everything. Is there a way to sort of prioritize what's the most pressing need right now?
So the pressing need now is equipment. It's oxygen equipment, and testing facilities. These are the two things. And what we're doing is we're bringing in oxygen concentrators that are mechanical. They concentrate basically the oxygen in the air, so you're not requiring the piped oxygen. At the same time, we're also bringing in the support in terms of providing hospitals where oxygen is really needed to be piped in, especially for cases that require a stronger pressure of oxygen. How can we quickly fit in some oxygen plants for them? So these are really some of the crucial issues that we're facing here.
You know, one of the issues here that we haven't really dug into, but I'm sure we will sort of in the coming months, is the number of children here in the U.S. that have lost parents because of COVID. I know UNICEF does a lot of work focused on children. I cannot imagine the impact on children in India. What have you been seeing?
So, you know, from the beginning of this crisis, what we have been trying to do is bring the focus on children, because even though the first wave children were not they weren't the face, they weren't being the first cases of COVID-19 infection. Yet the consequences for children were already seen in the first phase, because parents are being affected, and you know, their daily routine is turned upside down. They can't go out and even play with their friends. This round, we've seen as the numbers have increased, also the proportion, even if it's a small proportion, it's a higher number of children who are being affected. So it's really working with our counterparts and our partners, the Pediatric Association, to have the protocols for children in place to make sure that some of the children's hospitals are also getting the type of equipment that is needed. You brought the issue of children who are losing their parents, and that's a reality happening, sadly. Now, this is where we've seen the government really come in strongly to say we have to be focusing a lot more on it. So looking at in the state level, who are the children who have lost their parents, what sort of supportive care can be provided by their extended family, looking at the local civil society groups who could come together. There is a strong network of what we call child protection committees around India. How can they be brought on board? And of course, how do we address the psychosocial well-being of these children? I think this pandemic has shown us that the mental health fallout is going to be high. And for us, the concern is really how do we keep psychosocial and mental health for children in this pandemic? And we're working really closely with community groups, with volunteers, and with our counterparts to see that we're able to address it.
What about the vaccine rollout? It appears as if, you know, some of the issues that India is dealing with, we're dealing with here too, but, you know, it's sort of a much larger scale in that there's vaccines, they are available, sometimes they're going to waste because people aren't getting it, but then also you have the challenge of getting people in more rural areas vaccinated. What are you seeing with the vaccine rollout?
So, you know, that's another thing. We were a year into the pandemic, we were looking at and we were very strongly engaged in rolling out the largest vaccine drive in the world. And just to give you a sense of numbers, in 107 days, more than 157 million vaccinations have been administered. So it's a huge, the target, of course, is much wider. And here, what we have done is really built on what we know about vaccine hesitancy, about vaccine eagerness. How do we convince communities to avail of the facility? How do we keep a track on their questions, their fears? So a lot of our communication work is looking at the COVID appropriate behavior plus vaccines. And this is going to be a crucial part because we have to continue with it. As many people as we can vaccinate, the better for India. The government have opened up the vaccination for anyone over the age of 18. And our role really is to work with community groups, with any and all networks, with digital media, social media, with community radios, with any form of reach to people. And in many cases, we've seen, community-level networks are also taking this on. So that remains a huge priority. We're also helping the government in shoring up the cold chain equipment capacity so that as we see more production of vaccines, that the storage and delivery of those vaccines is also ensured. So yes, this is going to be continue to be addressed. And of course, every day we also have to be looking at the regular child immunization. So it's looking at vaccination for adults for COVID and the essential key services like childhood vaccination for that to continue too.
Dr. Yasmin Haque, thank you so much. The work that you and your colleagues do at UNICEF is incredible. Stay safe and stay healthy. Thank you.
Thank you so much.